it went pretty smooth, very smooth in fact, very timely way. This is probably our 10th arch or so that we've completed with this CHROME product, and I got to tell you, it is definitely the best workflow that I've ever used. I've done quite a few arches, many the traditional way of placing implants, guided still, but using a conventional denture, making the access points and then freehanding everything on a conversion side of it. I think the true value of CHROME, in my experience, is really on the conversion aspect. I think the surgical portions are fairly straightforward with many systems, but the differentiator, in my experience, has really been on the conversion side, where everything is very streamlined off of one platform. It's just the smoothest system. Just very minimal hang-ups, and even if you do have a hang-up, there's always a workaround in my experience thus far.
Mm-hmm. And how did you find the system? How did you find CHROME?
So CHROME, I was introduced to CHROME by one of our doctors, Dr. Shafitz, in fact, mentioned Roa Dental Lab in passing to me, and I looked at it a little bit further, and I spoke to a couple of other doctors locally who were using it, and we have a few surgeons locally who are also using this product, and that's how I beta tested it very carefully, and when I do surgeries, I really make sure, check and balance everything. So I very scrutinized it heavily on the front end, but I was fell in love with it after my first case. Case.
Excellent. Thank you. Jade, you're Dr. Chocksey's assistant. You've done the conversions on these cases.
Yes.
On some of the single arches. So what are your thoughts on the process? And
well, it's much easier than the way we were doing it.
Right.
Which would be, we made holes in the denture and then tried to tie everything in, and we were doing some couple different patients that we had to bring them back to finish the conversion later in the day because it was just taking so long to get it done.
Right.
But these ones that we've been doing with Ro are so much easier. Like the holes are in the right spots and everything's already ready to go. It just seems like a lot quicker. The conversion does take the longest out of everything in the procedure, but it's much faster than doing the conversion yourself.
Right, exactly. Well, listen, thank you for doing another case today, and we appreciate your business, and we'll be back to support you with all your colleagues as well, and we look forward to you doing a lot more this year. Okay.
Yes, absolutely. Thank you, Thomas. And again, I appreciate your help today. You were very, very helpful.
Thank you.
Just learning on every surgery, of course, it's a learning curve. But the more you do, the more you learn, and everything has been great thus far. So thank you very much.
Excellent. Thanks, Dr. Chocksey. Thanks, Jade.
Thank you.